Can you see my slides?
Yes.
Okay. A very happy birthday, Srinivas. And Chitra, thank you so much for this kind invitation. And wonderful program. I've enjoyed all the debates so far. So much to learn, how to debate, how to elegantly debate. Very proud to have so many Swaminathan alumni as part of the program. Okay. And Dr. Kamaljeet has already said that my topic is the valid one. So really, I'm not going to spend too much time, but just for fun, since it is the last debate, I just thought it'll make it a bit fun. So all stories in this presentation are the result of only my imagination. I give Dr. Chitra complete credit for this self-discovery of my hidden talent. Any resemblance to real life situation is scary as hell. Oh, worthy opponent, I offer my argument. So somewhere in an Indian PG residency program, second year PG, good morning, ma'am. I want to discuss our curriculum with you, ma'am. Next 3 months, I'm posted in glaucoma, ma'am. Ma'am, curriculum? Curriculum? Who put this idea in your head? That SR? I am your thesis guide and internals also for the exam. What early morning creating complications? PG, oh, sorry, ma'am. I just wanted to know what I should cover. Sorry, 1 second. Ma'am, I don't know. Go block the next case. 2 years later, she has finished MS, but she's called Dr. Missed It. Patient comes into the clinic. She says, a patient says, good evening. I went to 2 doctors and they found 2 different powers. So I wanted to get it checked by you, doctor. And then Dr. Missed It says, my technician is on leave. I can do by computer method. Hey, turn that switch on and dust that machine, no? And then patient says, doctor, but you yourself cannot check. And then doctor says, you know what, technician will come, you come back next week. And in another part of our great country, this is Dr. DNB, do not bother. Patient, good morning. Today I took leave and brought my child. She has squint and maybe vision is also less. She is only 3 years old. Dr. DNB is now scratching the head. How to check this brat? You do one thing, no hurry. You come when she can read all that ABC and all. Patient says, but you know what? I Googled it and they said that I should not delay. DNB, okay. We'll put some drops and we'll do something. Last scenario, I promise. This is Dr. DO, don't know. Patient comes and says, I just got transferred to the bank here. I was told before I came that I will need laser treatment to prevent some pressure attack. And Dr. DO says, sir, that is very advanced treatment. I will have to send you to the main branch. Patient, but sir, that is 300 kilometers away. Now, I am not joking. Where is the evidence for this kind of scenario happening? This is the READ study. This was published in the IGO in 2017. It stands for Residency Evaluation and Adherence Design Study. Basically, they polled young ophthalmologists, postgraduates who were finishing their residency program and asked them, hey, how was your clinical training? How was the teaching? How was the surgical training? These are the results. And you will be scared to see what the results are. Just a second. Here is a list of all the procedures that they are supposed to know. And if you look, refraction on a confidence rate scale of 0 to 10, 5. As you come down, look down. Pediatric visual acuity testing, 2. Retinal lasers, 1. Gag iridotomy, 3. And somewhere there, gonioscopy also is a poor 6. Now, why are we fussing about this? Is it really that important? It is important because what is the prevalence of diabetes in our country? 77 million. That is the number we are looking at. What is the prevalence of angle closure glaucoma? Various studies have said various things, but it can be even up to 4.3%. Our PG does not know how to do gonioscopy, does not know how to do laser iridotomy. What about refractive errors? 6.1%. No, PG doesn't know how to do refraction. What about visual impairment in children? Most important cause is refractive error. PG doesn't know how to examine children. So Santosh wrote very nicely in his editorial. Ophthalmology residency training in India, Quo Vadis. Should we look at the American style? ACGME accreditation guidelines. Oh, we don't have time for that kind of detailed documents. Okay, so maybe should we look at the ICO residency curriculum? You know, it says international, but really I was part of the ICO residency curriculum. It's really very Western in nature. So really, what do we need? What do we need is an India-centric curriculum. And Dr. Grover very eloquently in his article outlines it in 2018. And this was followed up by this publication on national curriculum for ophthalmology residency training. I was even wondering, is this an important topic? And I found on PubMed that Indian postgraduate residency curriculum, in the last 5 years, there are 20 publications. You don't talk about this unless it's important. So do we need to change? Without a doubt, it's about time. Otherwise, you'll get doctors from University of Google and University of YouTube who will be treating us in the future. Thank you so much, Dr. Chitra.